Brittany with Southwest Tech Nursing Program. I have doctor's orders here to do a blood pressure, apical pulse, and a head to toe assessment. Is that okay with you?
Yep.
Okay, I'm gonna wash my hands or hand sanitizer, and then we don't have any in here, but I did that and I would do it. Do you have any allergies? Can I get your name and date of birth?
Sure. Bethany Goose 52787.
That's what's on your wristband. That's what I have under my doctor's orders. I provided privacy when I shut the door. And then I have all my materials that I need. So we're going to start with the blood pressure. So I'm going to see the length is 2/3 of your arm, which it is, and then it's 80% around. And it is. Today I'm going to do a 2-step on you. So I'm going to pump this up twice. Find it right here. Okay, and then I'm going to go 20 to 30 above that. Don't listen this time. So I got 120/70, which is normal, so that's in good range there. And I would wait 2 minutes in between doing the first pump and the second one. So next I'm going to go to your apical pulse. So I'm going to start with your sternal notch, go down to your angle of Louis, go to your second intercostal, to your third intercostal, fourth intercostal, fifth intercostal, mid-clavicular, okay, and then I'm going to listen for a minute. .66, so that again is within normal range. If it wasn't, I would look in your chart to see what your normal range is, and if it was way out of whack, I would contact the physician.
Okay.
Next, I'm going to go to a physical. You start with your head to toe. I'm going to use gloves for this portion. So this would be my use for PPE. I don't know if I said that in the beginning. So first we're gonna assess your hair. I'm looking for infestations, any indentations, any cracks or sores, and I'm not seeing any, so that's good there. It doesn't feel bumpy or lumpy or anything weird going on there. Your hair is nice and a little bit thick. Good color, it's good length, it's growing evenly through. Don't know why it took all out. So your hair's all good there, nice and dry, and nothing's falling out, so we're good there. Next, I'm gonna move to your face. So nice symmetry with your ears, your eyes are nice and even, your eyebrows. Can you smile for me? Smile's nice and even, so that's good there. So next I'm gonna go to your I'm gonna check your nose, and you have no drainage going on. Your septum looks good, no sores, you don't have a big nose. We've seen alcoholics or anything, nothing there. It's nice and normal skin tone color. Can you check your patency? Put your hand, breathe up. Nice, good even breasts there, so that's good. Don't see any drooping or anything from your eyes either. Can you pull and move down to your lips, pull your gums out? Good. Your top. Good. So your gums are nice and pink, nice white teeth. Your outer lips are nice, moist, not cracked or broken. Your gums don't have any sores. Can you stick your tongue out? Your tongue looks good. It's not caked. Um, your tonsils good. Good jugular. Your back of your throat looks good. Nice pink color, not super red or any sores going on or any stones or lumps back there. So that's good. No broken teeth, so your mouth and everything looks good there. So then now I am going to palpate your your maxillary and then your frontal. Any pain with that?
No.
Next I'm going to move to your lymph nodes. So I'm going to do your occipital, your post-auricular, pre-auricular, your submandible, submental, posterior cervical, superficial anterior cervical, and then if you shrug your shoulders, your submid-clavicular. Those are all good. I didn't feel any lymph nodes or anything. If I did, you might have a cold or something that would inflame them. All good there. And then next I'm going to check your skin. So your skin is nice and cool, not super warm, normal color, it's dry, your nails look good, no hangnails, no clubbing, your nice color, your capillary refill's good there, so no worries with that. And then I'm going to go to toes, good. And then check edema while I'm down here. Good, no edema going on there. If she did, it would be 1 plus 1 is 2 millimeters, plus 2 is 4 millimeters, plus 3 is 6 millimeters, plus 4 is 8 milliliters. I'm going to check for phlebitis in your veins, and those are good, no hardening of the veins. I'm going to check for tenting in your chest. Good, nothing wrong with that there, so no concerns there. Next, I'm going to check for tremors. So if you could stick your arms straight out, good, no wiggling there, you're good, you can put your arms down. No contractions or in jerking around, you're not jerking, so you're all good there. So then next, I'm going to do your range of motion. So I'm going to have you push towards my head for sternomastoid. Good. And then shrug your shoulders for deltoid or trapeziums. Put your arm out like a plane. Go up for deltoid. Down. Good. So then put your arms out like this, so back towards you for biceps, triceps towards me, and then your wrists, push towards me, good, back, good, fingers, don't let me close them, good, even strength up through there, strength, good, even strength there, and then abduction, push out, adduction, push in, good, can you put your legs out, pull towards you for hamstrings, quadriceps, push out, go up and down for your ankles, dorsal and pedis, or plantar, and then I'm going to palpate your joints also. Is there any pain or tenderness? The temperature's good. And ankles, good. No soreness or swelling or anything going on there. So then I'm going to move on to your eyes. So I can take these off. Do you have any, do you wear contacts since I see his glasses?
No contacts.
No
just
contacts?
glasses.
Okay. Do you have any family history of eye problems like glaucoma or anything?
Mhm.
And then are you having blurry vision at all today?
No.
Okay. So if you can remove your your glasses for me.
Okay.
Okay, pull down your eyelids, good, pull up. Your conjugular and your scleral look good, nice white, pink, nothing going on there. So next I'm going to evaluate your constrictions and your dilations. I'm going to shine the light in your eye. Good, and same thing. Good, your eyes are dilating and constricting back, so that's good. Good. Next I'm going to check your peripheral vision. So tell me when you can see the pen.
Okay. 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 Alright.
Good. And then next, I'm going to watch your eyes, stare at this, and then the wall. Good visual dilation there with adjusting to the different visions. And then also, can you follow my pen with I do a star? Good ocular movement there. That does eyes. So then next we are going to move to your hearing. So first I'm going to look at your ears were symmetrical as we saw. I don't see any draining coming out of your ears or anything. No bleeding or nothing there, so that's good. I'm going to push on your turgor and you palpate your mastoid. Pull up on your ocular. Fold your pinna in. Any discomfort or anything there?
No.
I'm going to look in now with the otoscope. Okay. Good. You have a nice tympanic membrane. It's nice pearly gray. If you had an infected ear, we would start with the good ear and then go in to the infected one and switch out. Good, and there's no fluid or anything going on in there, so that's all good. Nothing concerning there. So then next I'm going to go to a whisper test. Can you tell me which ear you can hear this in? Good. And then it's good hearing there, nothing concerning with that. I did not ask you your 3 questions about hearing. Do you work in a place that has rough hearing that would cause injury? Have you ever had trauma to your ears?
Mm-hmm.
And do you wear hearing aids?
No.
Okay, good. So I think that concludes the hearing. So then next we're going to move on to neural. Your level of consciousness is good. You've been answering all my questions. Do you know who the president is today?
Trump, yes. I almost said Obama. Okay.
Do you know where we are?
I do. Southwest Tech.
Good. And what is the month?
It is September.
Good, your memory is good there. All those answers were correct. So that's good. Can I have you stand up and take some steps forward? Watching your gait. Your gait is good. And then I'm going to do a Romberg test now. If you can close your eyes, feet together. Good. No swaying or anything going on there, so that's good. You can have a seat. I'm going to do the Babinski test on you now with the pen. See if your reflexes of your toes flaring back, which is good. We see that in babies. If you had that now, we would have to go further into your neural exam. And then last with this exam, I'm going to go through the 12 cranial nerves. So we had your optic nerve when you, with your eyes, when you read this card.
Breathe, you are doing fine.
Good. So that tests that as well. And then we have your ocular motor, which we did the eye movement with the pen. And then we have your trigeminal. Can you close your eyes? Tell me where you feel this.
My forehead, my nose, chin.
Good. And then olfactory. Can you close your eyes? Tell me what you smell.
It.
Yep. And then we have your, if you stick your tongue out, we have good, move it around. That's your hypoglossal. Can you say ah? Good, that's your vagus. And can you cough? Good, your glossal hypogynephial. And then your auditory is what we did with your hands. Your facial, can you smile, frown, poof your cheeks out? Good. I think that covers all those. So then now I'm going to move on to your respiratory, cardiovascular, and abdominal. So we're going to start with your respiratory. Do you have any family history of respiratory issues?
No.
Have you ever used an inhaler?
No.
And are you having trouble breathing today? No. Okay. So first I'm going to have you sit forward. I'm going to check your ratio, your AP lateral ratio, so 2 to 1. And then I'm going to check your back while you're sitting here for scoliosis, kyphosis, and lordosis, which is good. I'm going to palpate your back. Any pain?
No.
Can you say 99 as I go down?
99, 99, 99, 99, 99.
Good. Even breaths through there. No problems going on there. I'm going to check your chest extension. Good. My fingers come back together with that, so that's good. Even breaths on both sides. One's not working harder than the other. Your breath, you don't seem to be working too hard breathing either, so that's a good sign you weren't running before you come in or anything. No excessive effort. I'm going to listen to the 18 sounds of your breath. Take a deep breath. Good. 1. So that was 4, so I'm going to show where the rest are. 4, 5, 6, 7, 8, 9, 10. So if I go under your shirt.
Yeah. Whatever you need to do.
So then 10, 11, 12, 13, 14, 15, 16, 17, 18. Your breath was good through there, nice even on both sides. So then next we're going to move to the front. I'm going to palpate the front. Any pain with that? Okay, so I'm going to listen to the front as well. Listen to 10 spots. Good, and now I'll show the rest. 4, 5, 6, 7, 8, 9, 10. And then next I'm going to listen to your jugulates. Take a breath. Good. One more time. Good. Even sound breath through there, so that's all good. Next I'm going to check your jugular distension. If you could lay down on the bed for me. Good. I don't see any distension going on. If I did, I would raise your head up 45 degrees and see if that subsided back down. If not, we would have to do further testing. And then now I'm going to move on to your cardiac. So I'm going to palpate. We already palpated to see if you had pain. You had no pain there. I'm just going to palpate for your heart. Your beat is good. It's nice and feels nice in rhythm. I can feel it, so that it's not there. You are alive. So next I'm going to listen. I'm going to listen with the diaphragm side first. So I'm going to go to the sternal notch, to the angle of Louis. I'm going to go to the right this time and listen for the second intercostal and hand for the aortic. Good. I'm going to go straight to the left for the palm neck. Good. Those both are signs of the S2 sound, the dub, and then I'm going to go down to the third intercostal for the Erb's point, where you can hear S1 and S2, the dub and lub, equally. And then I'm going to go down to the S4 for the tricuspid, and then S5 midclavicular for the mitral, which are both S1 sounds, and they are both the lub. Good, even there, and then I'm going to do the same thing with my bell side. On the sternal notch, ankle Louis, second intercostal. Good. So the aortic and then the pulmonary. And then the Erb's point. And then mitral, or the tricuspid, and then the mitral. Are good. Good even sounds there. There's no absence or beats, so that's good. No signs of murmur going on, so that's good. Okay, so now I'm gonna move on to your abdominal. Did you void before this exam? Okay, if you could have you flex your feet up. Is it okay if I pull your shirt up a little? So your symmetry is good, your color is good. If you could lift your head for me, good. I don't see no hernias, no bumps or indents or anything like that. So first I'm gonna listen on this exam so that way if I hear something we aren't rupturing anything. So I'm listening with my diaphragm first in the 4 quadrants. Good. And then I'm going to listen with my bell side to the vein, so the aortic. And then the renal. And then the iliac. And then the femoral. And then next I'm going to percuss for listening for dents and sound in each quadrant. Any pain or anything with that?
No.
And then next I'm going to press down and tell me if you feel any discomfort. I'm feeling for the different organs. Tell them where they're at. And I didn't hear no echoing or anything with the percussions. Any pain or discomfort there? No. Also, that concludes that one. I'm gonna go and check your pulses on your peripheral side since I did not do that earlier. So you have your temporal, good, your carotid, good even beats on each side, your brachial, good, your radial, good, femoral, your popliteal, which is sometimes kind of hard to find, and then your posterior tibial, and your dorsal pedis, and those are all good, even on both sides strength. Is there any questions on anything I can do for you while I'm here?
No.
Alright, I'm gonna go document.
Okay.